Good morning. Good morning. Good morning. Everybody take a seat. We got a lot of things going on today at the Challenger class. Thank you. Good morning. Good morning. All right, here we go. All right. The show's just about ready to start. Okay. All right. So do we have any visitors here today? Do we have any visitors? No visitors? Everyone is a veteran at the Challenger class. Okay. That's wonderful. Okay. Now we're going to make some announcements. And did I see Tammy? Okay, I didn't see Tammy. All right. So, Connie. Where's Connie? All right. Connie's going to make the first announcement.
Good morning. Jim and I have a flower ministry at our church. We've been delivering flowers from our garden for over a year and leftover flowers from the church through the winter months to people that might need a smile on their face. They give us a list on Tuesdays and we just deliver flowers. That being said, we have been getting vases from Dollar Tree, but we realize that people usually have vases just stored at their house that they end up taking to Goodwill. So we have 2 boxes here that says Flower Ministry Vases. So bring us your vases. We don't want really giant size, but anything medium or smaller we'll take. And we'll store them at our house, and someday you might be a recipient of those flowers. So thank you.
Thanks a lot, Kelly. All right. Very good. Does anyone else have an announcement that they would like to offer for the class? No? Okay. Oh, yeah. Yep. Meredith. Meredith.
There is a correction to the room number for Cinda Viles in Houston. I think there were 3 numbers. It's 1209 is the actual room number. So if you see that, it might get to her, but it'd be nice to have the right number. 1209.
Okay. 1209. Okay. That's what that was. Okay. All right. Now we're going to have Keenan come up and introduce our speaker. And absolutely.
Well, Lord, it's us again, and we thank you for what you're doing in our lives. We thank you for the ways that you have touched our hearts to reach out to others in all sorts of ways. And we are grateful for our speaker this day, because all of us are getting older every day. And so we thank you for those that work hard to be available to others in need of information and care. Thank you, dear Lord, as always, for the many ways that you do care and look after us. We pray for those in our Sunday school class with family members dealing with health issues. And we thank you for the love and care that this group shows to ourselves and to this church and beyond. To you be the glory. In Jesus' name, amen.
Thank you. On a personal note, I had to go through a hazing process at Meadowbrook in the heat for 9 holes, and I passed. All right. So then I got to participate in the 19th hole, which usually is my best hole, and such. But I had great support with 2 ladies, Linda and Cindy, and it all takes a village, to play golf, 1, all right, and to look good is 2, all right. My late father was a banker, and he goes, if you can't play the game, look good and carry a pin, and the reason for the pin is on the 19th hole, after you've entertained individuals, in the other business community and such like that, is to sign a contract. All right. So I adhere to that, carry a pin and look good. All right. So there we go. All right, Keenan. Oh, yes. Oh. They did a great job. And one last thing, due to construction issues, concerns and such like that, the Briggs will not be hosting the 4th of July party. Sorry to announce that, but it's true. Okay. Keenan.
Good morning. Well, Life Senior Service is a real asset to the Tulsa community, and I talked Donna into coming and talking to her. I had never met her. So when I read this resume, I was blown away. I said, I can't wait to meet this lady. She's got multiple degrees from ORU, including her bachelor's in evangelism and counseling, her master's of divinity, master's of art, a degree in biblical literature, all at ORU. And then after graduating from ORU, Donna continued her educational studies at the University of Oklahoma and received a master's degree in social work. She is a licensed and ordained minister, so she's going to come back sometime and lead Bible study. So here is Superwoman Donna Mancini.
Everybody hear me? Okay. Thank you so much, Keenan and the Harbor Church, for inviting me. I really appreciate this opportunity to come and speak about Life Senior Services. How many here know about Life? Oh, very good. Very good. All right. I have a couple of these books and the magazine that are over here, but you know, you can pick these up at other places as well, which I'll get into and talk about. But I wanted just to talk about Life Senior Services, give you a little bit of background information, and talk about the variety of services that we have, that it's unbelievable to me how many people do not realize what all we do. And as you well know, and of course I am a research nut, that the more you study about our population here in Tulsa, the more you realize, guess what? Seniors are living longer, and we're hoping that we can live in good health and also understand what exactly the services that are out there that we can tap into, not only for ourselves, but for our loved ones. So it's real important that we get an idea. I'm surprised, like I said, that many people don't even know about Life Senior Services of all that we do. Now, I'm hoping I get this right, so we're going to walk through this. All right. Since 1973, Life Senior Services has been providing information, education, and services for our community. And one of the things that we really strive for is promoting the dignity of the individual, striving to allow each person to be themselves, be a voice to themselves, be heard, and be treated with the respect and dignity that everybody so deserves. Now, another thing that we talk about with Life Senior Services is within our department, I'm going to kind of break it down and make it as easy as I can. Life Senior Link, anybody that calls the 664-9000 number, you are calling SeniorLine. That's Lydia, she's like the operator. And she will direct you to wherever you need to go. Sometimes she'll ask you a little bit more information to kind of get a grasp on what exactly you need and then hook you up with the right people. I'm also going to talk a little bit about our programs and then addressing the needs of seniors. How many know that right now, one of the great needs for seniors is housing? Anybody else know another? Food. Transportation. I'm going to give you some stats here. Housing in Tulsa, how many are familiar with the Day Center? Downtown, okay. Mark Holtum, who was the director down there, he stated in June 2023 that he had 48,000 visitors. By the end of June 2024, he had 56,000. It was an increase of 17%. Food insecurity in Tulsa, 1 in 6 of Oklahoma adults and seniors and 1 in 4 of Oklahoma children are food insecure. Guess where Oklahoma ranks? Yeah. Oklahoma ranks 6 out of the top 10 states where families struggle the most with hunger. Do you know number 1? Somebody say Arkansas? Arkansas. Transportation issue, you know we have a problem there. It's high cost. We're also looking at the number of buses available. Scheduling is a problem. According to WallHub, Tulsa ranks, guess what, out of 100? 95, you were close. And that's 95 out of 100 in the cities of best and worst public transportation. Another thing that we're talking about, I'm going to get into that in a minute, is the transportation for older adults. Guess what? Visual, they have problems. Mobility, they have problems getting on the bus. Lack of transportation impacts our health and well-being because we cannot get to the doctors, can't make our appointments. The hours that public transportation is available sometimes doesn't meet our needs. And then the high cost for private transportation. Denise was the contact person at Life Senior Service for transportation, and so she could probably even tell you a little bit more about the cost of just private transportation from one place to the next and then back. What's it about, 35, 45? And that's from Sand Springs. Probably a little lower in Tulsa area, but yeah, it's expensive. Healthcare, behavioral health. We have lack of specialists. The amount of pediatric specialists that we have compared to the amount of gerontologists, the numbers are incredibly, over here super high, over here super low. A lot of times we have people come in, they need to see a urologist. Sometimes it's a year out before they get to see somebody. So our healthcare system, we need more doctors and professionals to come into the state of Oklahoma. As far as with health and well-being, in 2024, we ranked 45th in the US out of 50 states. And our mental health, we have got, even with our physical health, got to increase, got to get better. Got to be able to keep ourselves healthy and be able to know what professionals we can connect with. SeniorLink, which is the department that I'm under, and I'll go into that a little bit more. We usually serve populations 65 plus, 55 plus if they're disabled, Tulsa and the surrounding counties. And then that SeniorLine number, who is Lydia, she will answer. She does a fantastic job, and she will connect you to whatever services you need. These are the issues we just talked about. Anybody else have anything else that they'd like to add as far as any other needs that maybe you picked up on that are outstanding for seniors? Whoops, that pretty much covers it, right? Oh yeah, well, we'll get into that. We'll definitely get into that because especially in the line of work that both Denise and I do, caregiver support, caregivers, informal caregivers, those that are not being paid, taking care of a loved one, they are walking in loneliness. They are hurting in their silence because a lot of folks, unless you're walking in their shoes or have experienced something like that, the degree of stress and pain and loneliness and grief is tremendous. So it's real important, and that's where you build your support systems. Here you can see older population growing. You look over here, 1970, and then look over up to 2020. We'll go just with a few. Over here with the 18 to 24-year-olds, you can see it's decreasing. The birth rate 0 to 4, age 0 to 4 up there, 6.9, decreased. Over here, seniors 65 to 84 increased 51.1%. Then you have 13.3% for those 65 to 84. And then over here in 1970, it was 0.6 for 85 years and up. And now we go up to 2020 and it's 1.8%. So you can see where it's increasing the numbers. SeniorLink, SeniorLine, this is what we do under the umbrella of SeniorLink. This is, like I said, the department that I'm in. Independent case management, behavioral health counseling, caregiver support counseling, transportation, and elder abuse prevention. We're going to talk about case management. Independent case management. Denise and I used to actually be case managers at one point. And what we did is when a call would come in, we would assess the needs of each person that was calling to find out exactly what they needed. Maybe they needed a form filled out, Medicaid. Maybe they needed to figure out where they go and get their Social Security stuff. Or they needed someone to help them with housing, transportation, or someone just to be able to help them with different issues regarding clothes. Where do we get food? My mom can no longer cook. Are there places out there that the food can come in? So we would just dive in, and whatever their needs are, we would work with them. And then we would follow up at least 3 times with the family or the family member to let them know that they're connected to someone. All these services are free. We would have walk-ins that would come in. I don't know what to do. I'm a vet, but I can't get through to the VA and I need hearing aids. What do I do? And we would sit down and we walk them through it, place a few calls and help them out. So in any way we could do case management, that's what we did for these individuals. And like I said, all this is free. Behavioral health counseling, we are partnered in with Family and Children, and we have a therapist in our particular area in the building that we're in. And she sees our older folks and will work with them, whatever their needs are, including she also specializes in dementia. So she's there to help. And that's a big thing, people needing to connect. When you talk about loneliness and grief and all these emotional feelings and nobody to connect with, we do have somebody to connect with. Also, caregiver support. Now that's the area that Denise and I are in. Caregiver support, what we offer is incredible, I think. Denise, over here, when people need an intake, they come in, they see Denise, she does disease education, she talks to them a little bit about their situation, gives them the support they need, hooks them up with resources, and then if it looks like they really need to connect with somebody else and see somebody one-on-one for individual counseling or education, then she connects them to me. Transportation, we just got, did we say a grant for transportation? We were just kind of blessed with transportation and vehicles. So now we can offer transportation right now to our community members. And anybody that needs transportation, all they need to do is call in, talk to Lydia, and she'll hook you up. And then we also have elder abuse prevention. We're connected and partnered in with DIVIS, domestic violence. Believe it or not, there are a lot of seniors that are being abused, whether it be financially, emotionally, spiritually, physically, you name it, a lot. So we have somebody from our department that goes over to the DIVIS building, and she will work with individuals. She'll be a court advocate, and she'll take care of them the best she can. If they need to find housing, she works in that area. Independent case managers also, like I said, connects people up with food stamps if they need food stamps. Housing applications, Oklahoma Finance Housing Agency. LIHEAP, anybody know about low-income housing? It's for those that cannot, that are low income but maybe need help with their electric bill. If you qualify for that program, it's a huge savings off your electric bill. And for some folks out there, $20, $40, $60 is huge. And they can get that twice a year. And then if they have an outstanding overdue bill and they meet criteria, they can hook in and get the emergency low income voucher. This is the behavioral health. Like I said, we're partnered in Family and Children, free counseling, in person at Central. Also, she goes out to some of our properties, which I'll talk about a little later. So we try to make it as convenient as we can for senior citizens and work with them in the environment that they're in. Caregiver support. We have 3 caregiver support groups right now. One's at Vandiver House, which is in Broken Arrow. We have a caregiver support in Tulsa, over at Roma, and we have one in North Tulsa. Plus, we offer free respite care provided at 2 Life Adult Day Health Centers. We also now have a men's caregiver support group. These support groups are great for a family member who are definitely needing support in a group setting. They have worked with a loved one, I'll just say that has Alzheimer's. And they're figuring out, I feel so alone, I don't know what to do, it's hard to communicate, I get agitated, I get angry at times. These support groups are wonderful. So they can go and talk with other folks of like-mindedness, discuss issues, and together they brainstorm and actually help each other. It's so wonderful to see that happen. So we do have 3 of those that are mixed groups, and then one specifically that's for men, and that's held at the building I'm in over at Central. Denise does the care consultations, and I do the caregiver counseling and support. Any questions with this so far? Here's the transportation that we talked about, 55 and older. Various levels of disability, service area, Tulsa County. We also have vintage housing properties, which I'll talk about, but the transportation services extend to our vintage housing properties. So anybody living over there that needs to go to a doctor appointment or other appointments, they're also involved and get the services they need. Tiffany is over transportation now. So if anybody wants to call directly to her and talk about transportation, or they can contact SeniorLine, and speak with Lydia and just ask for the transportation department. And then we just ask for 72 hours notice or 3 working day notice. Yes. Yeah, I think it's kind of partly half and half. We do have people that are employed through Vintage, and then I think some of them may be volunteers. What do you think, Denise? Yeah, not quite sure. This is something that just recently got started. And somebody was kind enough to donate how many vehicles? I don't know, a fleet of vehicles. A lot of them. Now that you won't see PACE on the side, you'll just see Life Senior Services. They're the vehicles that were just recently wrapped that were donated that we could use specifically for transportation purposes, which is yes, which we said earlier is a huge need. It's one of the huge needs here in Tulsa for senior citizens is to be able to get around. Those that are limited with walkers or wheelchairs, whatever, that bus, if you have to take a bus, or if you don't have your own car transportation or a ride from a friend, that's just not feasible. If anything, you talk about emotional stress level going up. If I have to know I have to plan to go out there and try to get a ride on the bus with a walker or a wheelchair and figure out how to get up the steps of the bus and what time the bus is going to show up and if they're going to be late, am I going to miss my doctor's appointment? Oh my gosh, if I'm late, is the doctor appointment going to cancel me? There's so many factors and it's crazy. Just like it's not really people friendly. So we're trying to make it better here. But good question. This is the elder abuse prevention that we're partnering with Divis, like I said. And Valentine, she goes by Val, she's done a tremendous job now with connecting with Divis, and also she's an employee of Life. And she goes to court on behalf of the individuals. People are scared. What do I do? My husband's hitting me, and or my daughters are taking my money. My husband just passed away, and all of a sudden the daughters are stepping in, wanting to take all my money, and I'm afraid. Who do I go to court with? I'm all by myself. And she just says, I'm right here for you. And we'll go to court with them. And then she'll help them fill out the paperwork and everything she needs to do. And also there's times where they may have to leave their home, maybe domestic issues. And she's right there, and she will look out in the community and see what's available as far as housing and get them moved in. Just want folks not to feel alone. How many are familiar with our magazines? Good. A lot of good stories. Like I said, these two, a lot of good stories in here, some advertisement. And then in the bigger book over here, this thing is loaded with information, especially if people need to go into different types of assisted living, long-term care. It just spells it out, what the facilities take, what insurance they take, what type of services they offer. Because nowadays, it's just real important that you do your homework. I have one client that actually her loved one is in a facility, and of course, it's expensive. And one of the things she says is every time he doesn't even have lunch in the cafeteria, that's another $10. So 3 days, breakfast, lunch, and dinner, that's $30 extra on top of what all they're paying, just because he feels more comfortable sitting in a room. So it's really good to find out these little hidden fees that are out there, what's going on, and then also see what they can provide for your family member and get to know the staff and all that good stuff. But these are available at Reese's, of course, Life Senior Services, and CVS. Magazines are free. You can also get it now digitally if you want, if you're computer savvy and you want to get on and see what all we have so you don't get the paper. You can go in there and check it out. A lot of interesting articles and columns, very informative. And then the guide, of course, is just whatever services that we can put in there to help with housing or healthcare, caregiving resources. And then our books are usually available in bulk, like to hospitals and other facilities. Yes. Well, thank you for sharing that. Yes. It does. Thank you for sharing that. It really does. It's very informative. Yeah, I'm sorry. What did you say? Yeah, yeah, good. I love the puzzles. I love the puzzles. Isn't it funny what we turn to and go to? Stress relief. Give me the puzzle. I want the puzzle. But that is true. Roma Berry. How many have been over to Roma Berry, our adult? Great. Our senior center. There is so much over at the senior center. Let me see if I have a little write-up here. Okay, you ready for this? Those that haven't. Exercise equipment. Beginner's pickleball, yoga, tai chi, dancing, basketball, line dancing. All kinds of exercises that you can strengthen and tone yourself, even sitting in the chair. You have ping pong, sing-alongs, ceramic, pottery, creative writing. Then there's luncheons that go on. They play cards, bridge, canasta, chess, day trips, theme parties, weekend dances, karaoke, creative art classes. They had a huge kiln. Guitar class, guitar lessons, harmonica lessons, ukulele. There's all kinds of stuff. They will even help those that want to learn computer stuff to be able to let you become more familiar. It is just a wonderful, wonderful program. But under that building, and even over here, over on this side would be the pickleball court. But under this Roma Berry, it houses the activity center. One of the adult day health programs is over there. And Life Pace. Anybody here familiar with Life Pace? Okay, well, we'll get into that in a little bit here. Okay, the senior center, if you're 50 plus, you can become a member. It's only $100 for a year. And then you have all the things that I mentioned. They have beautiful places outside, walking areas, sitting areas. It's really a lovely, lovely facility. And it's only been up, I think, a little over a year now, year and a couple months or whatever. And then any other questions, you can always contact that number. Like I said, the adult day health is fantastic. Suppose you have a loved one that wants to be a part of a caregiver support group, or you just have a loved one that you feel like, you know what, I need a little bit of downtime, respite time, whatever. You could take your loved one over to the adult day health. And this is for those that need more one-on-one, kind of professional one-on-one care, but they're also within their own group. Open 7:30 a.m. to 5:30. Vouchers and Medicaid Advantage waivers and things like that. If you need something to get in for free. They have lunch, snacks, activities, social interactions. They do all kinds of activities as well on the level that they're at. And then we have 2 locations, one at Roma and one on North. The difference between the adult day health and the Life Senior Center is Life Senior Center is for those that are up, physical, can be engaged, can do various things. The adult day health are for those that have more physical or mental or cognitive challenges, that just need more support from a CNA or somebody on standby, but they also have their own group and their own activities that they can engage in. So it's great for social interaction. It's great for connection. And then, like I said, roam-up areas for those that are up there. We have a 90-some-year-old man over there playing pickleball and just loves it. So you can just get out there. If you're active and fairly good health, then you would want to be a part of roam-up area, the senior center. Any questions between the two? Now, Life Pace, that is a program, an all-inclusive care for the elderly is what it's called, for those that are 55 plus. I call it like a wraparound program because they have social workers and counselors and doctors and nurses and occupational therapists and physical therapists and you name it. And they wrap all their services after they do an assessment with the one that needs their care. They wrap whatever services around that particular person so they have the best plan of care possible. And they also have access to full treatment team, medical services. There's nurses and doctors over at the Roma-Berry. PACE is in the Roma-Berry Center. And then they recently expanded their zip code, so it's covering more area. But if you're within a financial area range, you qualify. This is a fantastic program because it's in-home care. Instead of putting somebody in a facility, these folks will come into your home. They'll have people that will come in and maybe assist with bathing your loved one, feeding. They do light housework, various things like that. You can still see, if you have a doctor, your own doctor twice a year, but they also provide their own staff, medical staff. So it's just really good for those that are saying, no, I don't want to go in a facility. I want to stay in the comfort of my own home. And I want to be around my family members, but I need someone to come in to help care for me, take care of me. And as long as the person is able to get up and at least leave the place, walk out the door, they're that mobile, and financially within a budget, they would qualify. They don't want someone who's bedridden because God forbid something happens in the house and they can't get out. You know, that's just not the type of care. But if you have somebody that's in the home that is in a way where they do qualify for nursing care, but the individual and the family are saying, no, we want to keep them in the home, this is the program. Advantage case managers, the Medicaid Advantage program, they have their own case managers that will also help. This program is also for those that meet age, income, and level of care requirement, nursing home. This is another program, this Advantage Medicaid, is to keep folks within the home so that they don't have to go into a facility. And then the funds are used for home and community-based services, enables at-risk seniors 65 plus to live in the safety of their own home. Vintage housing. How many have heard of our vintage housing properties? All right. Do you know we have apartments around town? Got it written over here. We have 19 properties, and every property has about 32 to 48 apartment complexes. And we house folks that are on a strict income. They're all around, Broken Arrow, Tulsa, Catoosa, Claremore, you name it, they're all around. And they also are wonderful for folks that want housing, indoor housing, everything is inside. So it's more community-based. You kind of have a property manager there, a little bit more safety, but it's just a great place for folks that really want housing, but they don't want something where they can't get into, such as some of the community apartments where they have to go up the steps or whatever, they don't have an elevator. Here, these are usually 2 stories, and every building has an elevator. And then case management services. That's where life comes in again. Do you know that every property is assigned a case manager? And they go out once a month to those properties and offer case management services to everybody in there that wants services. So if they come down and say, I just, for some reason I didn't get my food stamps and I need groceries, whatever, we're going through resources to try to connect them to get food for that time. If they say, oh my gosh, my Medicaid, it's like, it's going out of date. I gotta renew it. Oh my, and they're frantic. Just sit down. put it in here. Because what we put in here gets directly set straight over there. So we don't have to have all this paperwork. So we're there to de-escalate, but we're also there to try to get their issues resolved. And so every property has a case manager, which is cool. Different properties, usually there is, but different properties as far as the turnover, I just encourage everybody to call SeniorLine, call Lydia, and she'll connect to somebody in our department, and then you could talk with them, because every property is different. Some have so many on a waiting list, some have less on a waiting list, some may have a turnover that's greater. I always encourage people to just call in and ask. But they're nice. They're usually one bedroom. I think some of them are two. They have their own bedroom, living room, kitchen area. They're nice apartments. There's the Medicare Assistance program. Anybody hear of that over at Life? For Medicare and tax assistance. This is free services. Medicare, Kathy, who's the director, she works and does seminars regarding Medicare, answers any questions, compares Part D, tries to find the best plan for individuals, and saves folks a lot of money. People that don't realize what plans they can get on. Free tax assistance for eligible seniors 60 plus, as long as their income is 68 and under, and they do all the tax preparation and filing for free. So if you know of anybody that needs those services, encourage them to come on over to Life. We also offer education services. We have different people from the community that will come in and teach on various topics, various speakers. Anybody that needs professional continuing education units or credits, they can come, take a class there. Social workers a lot of times need their CEUs. How many have heard of the volunteer program? What have you heard about it? I know. I wanted you to share that. It's a great program. I had a gentleman one day that was just in tears. Don, I'm so lonely. I just really want to do something. I'm still in good health. I don't want to just sit at home. And I started telling him about the Give 5 program. And that is such a super program. Age 55 plus, you can just fill out an application online. Somebody will get back with you. You just attend 5-day classes for 1 week. You get to meet various heads of agencies, the Day Center, Catholic Charity, John 3:16, Salvation Army, you name it, all these various places out there. And then you can say, you know what? I got an interest in that. I think I can do that. I really want to go into the retail over there at Salvation and work in the clothing or whatever it may be. After the training and meeting folks, everybody gets on one of our big buses and we go around to the facilities. So you can ask your questions, see what the facility is like. You want to work at the food bank, whatever. And that's what they're there to help you with. So it's one of those, I'm retired, but I can still do a whole lot. I want to give back to my community. What can I do? Perfect program. Give 5 is what it's called. Yes. Yes. Oh, wow. That's a lot, yes. And Tulsa is such a giving community. And there's so many good places to hook up with. So I'm glad you shared that. Thank you. Any questions at all about, well, I know I went over a whole lot. Yes?
Microphone.
Do you have an estimate as to how the proposed cuts in Medicaid will impact your services or ability to deliver your services?
How what? I'm sorry.
Do you have an estimate as how the proposed cuts in Medicaid will impact your services?
Okay, yeah, well, all right, I'm going to limit myself here and stay in my lane. I know nothing about how that's going to affect Medicare or the taxes or anything like that. Kathy would know a whole lot more because she goes to classes and is very educated in that area. And so if you have any questions like that, I would encourage you. She's out right now, but like in a month, call Life Senior Services and ask to speak to Kathy Jones. She knows a lot about that topic. And I know that with the folks that I work with, there's a lot of people worried about what's going to happen with Social Security, Medicare, Medicaid, because some folks are on the PACE program, they're on Medicaid, their loved one is in a facility, and if Medicaid gets cut, they're like, oh my gosh, does that loved one come back to my house? I'm not equipped to care for him anymore. What do we do? And my job right now is to tell folks, just take a few deep breaths. It's going to be all right. Just work with the space that you have, ask questions, talk to folks, call your congressman, whatever, but don't allow it to snuff the life out of you. You hear what I'm saying? Don't allow the stressors that are going on out there to get you to the place where you can't eat, you can't sleep, you're worried all the time, because now I'm going to go into Christianity. That's not God's plan. That's not God's plan. Take care of you, protect you from negativity and how much of the news you hear and what's all going in, because when it's coming in here, it's also getting in our spirit. And it's going to affect our mood, our disposition. We're going to be anxious. So questions, yes. Call Life Senior Services and hook up with those folks. But as far as what you can do, keep yourself at peace and knowing one day at a time when we'll get it together here. We'll figure it out. Is there a question over here? Yes.
Do a lot of the residents that live in retirement communities like Monroe, Trinity Woods take advantage of these services?
Depending upon their financial eligibility, what they qualify for, it's usually those that Medicare, Medicaid. You can also do some self-pay, but the programs are set for those that, like for an individual, like with long-term care, Medicaid, I believe it's $29.01 is what you can make per month. And you cannot have over $2,000 assets. So you're restricted, you're limited. Some of these other facilities out there, they're for those that can really afford it and have the finances. But for those that are on a fixed income, can maybe pay a little bit of self-pay, but are depending upon Medicare and Medicaid, PACE and Medicaid Advantage would be the way to go. Yes. Yes. I'm so glad you said that, because I was going to tell you, all those services under SeniorLine or SeniorLink, all United Way funded. Now, when you go into, you're with United Way? Oh, yes, United Way. And we are so grateful for United Way. And then as far as with PACE, Advantage, they're connected also with some other state and federal programs. They get some assistance there. Well, thank you.
And that's all I wanted to say.
Well, thank you so much. You're amazing. I appreciate you.
Yep. Thank you. Thank you very much, Donna.